Hello, students. Guess where you're at? The College of Saint Scholastica. Hi. Welcome to Class 4, Individuals and Families. We're going to spend some time today talking about the two topics that are listed in the corner of the screen. Uh, Counterproductive patterns of communication, as well as verbal following, exploring, and focusing skills. So we're going to spend some time here today really looking at some of those important aspects as you prepare to start to do your interviews. Um, these are very important learning aspects and will be a part of your experience as a social worker. So without any further ado, let's jump into today's lesson. So what we hope to do today in terms of looking at counterproductive communication patterns is really spend some time doing just that. The interview is a very significant part of the work that we do with our clients. It's a huge part of assessment and a way for us to really start to formulate a therapeutic relationship with clients. And so there are a lot of things that social workers, especially as beginners, are often well-intentioned, but are actually involved in behaviors that are sometimes counterproductive into the work of the clients that they are charged to serve. So two things we're going to try to highlight in the session today in terms of takeaways and learnings is to identify when you've experienced an error, should I say, in counterproductive verbal communication and nonverbal communication, and then identify constructive alternatives in those instances. So really helping you become more aware of how you practice in terms of what your skill sets are in the process. So with that being said, let's talk about nonverbal barriers. And so when we think about nonverbal barriers, we're thinking about looking at and physically attending. So really paying attention to what's happening with our clients, what's happening as it relates to where they are. So some examples might be maintaining eye contact or not maintaining eye contact, or um, is your client relaxed? Are they fidgeting? So really looking at the things that they're bringing to the room. Also recognizing that there are cultural nuances as far as it relates to nonverbal communication or cues as well. In some cultures, for example, American culture places a high premium on direct eye-to-eye contact when you're working at folks. Otherwise, you may be considered untrustworthy, while in some cultures of color, American Indians, for a specific example, eye-to-eye contact is seen as something that's disrespectful, especially when you're looking at a person in a position of authority or an elder. So again, to not confuse those, and so we need to spend some time really understanding some of the basics about working with cultures that are different than ours in terms of how some of those nonverbal cues are communicated. Some other nonverbal cues really are examples of what happens in your environment. So are you in an office with a cluttered desk? Is your phone ringing throughout the context or throughout the course of the conversation? Are you being interrupted? Is the intercom on? Are there things in the room that are just visually distracting in terms of the setting? So these are barriers sometimes to communication, because we have to also pay attention to these things as clinicians. So again, it's about recognizing what those nonverbal patterns are and then looking at developing a plan to reduce them over time. So here are some tables that just have some recommended and not recommended things as it relates to facial expression. So this is about how you're coming across or how you're being perceived. As you can see, there are a lot of things to take into account. So as time goes on and as you become more familiar with the art of doing client interviews, some of these things will become routine. And initially, on the onset, it looks like a lot of things to pay attention to. But there are. Some of them are more common sense, but also just make sure that you're paying attention to these things as you're moving forward. So again, how to eliminate some of those, eliminating those verbal barriers. And there are a list of things here that we'll talk a little bit about in terms of some things that you can do as it relates to eliminating those verbal barriers. So reassuring. Oh, that's my phone. So reassuring. So advising and giving suggestions or solutions prematurely, using sarcasm, employing humor inappropriately. All of these things that are here in terms of these barriers are often things that newer social workers will find themselves doing really for the most part out of their own um, consciousness about not being adequately prepared or not feeling adequately prepared or confident in terms of their interviewing skills. So these things will come to light time and time again. So it's about recognizing them and working through them. So again, things to be careful about when you're thinking about reassuring or sympathizing or consoling. Telling clients that things are going to work out tomorrow or it's going to be okay. I mean, you don't have really a basis for making that particular notion, and so you want to be careful about how you do that. It's okay to be empathetic with your clients and to even sympathize with them, but to actually be premature because sometimes our need to take care of others kind of supersedes, and we'll say those kind of things without really having any basis for why we're doing those things. So to be careful with that. Giving advice prematurely. So again, a huge temptation in terms of really looking at wanting to be helpful, but giving information too soon can be problematic. You know, the advice should be offered sparingly when you're doing those kind of things, and only after you've done quite a bit of time exploring what the problem is, because sometimes you can give people information prematurely and not have a clear understanding of what the issues actually are. So using sarcasm or employing humor inappropriately. So, you know, if a client is talking to you about something that's very serious, it's probably not a good idea to spin it into a humorous situation or a joke. Judging, criticizing, placing blame. If we think back to our operating values around that, so be careful that in your speech that you're not doing that. Trying to convince your clients about the right point of view, lecturing, instructing, arguing. All of these things that are here are things that you really want to avoid in the context of your conversations with your clients. So one question at a time, stacking questions. Sometimes you'll have folks who will ask a series of 3 questions all in one. And it makes it hard for the client to actually ascertain what kind of response you're actually looking for. Asking leading questions, or these are questions that you're basically leading people into where the answer might actually be, and you want to be a little bit more open-ended. Interrupting, making sure that you're not dominating the interaction. You know, social workers shouldn't have 80% of the dialogue shouldn't be the social workers in terms of your interaction. So we want to change those numbers. Fostering a safe social interaction, really letting people know that it is okay to share with you. Responding infrequently, you know, may give the impression that you're not real clear about whether you're understanding the client or what the needs actually are. Be careful about the phrases and the cliches. dwelling on the remote past, and then just kind of going on this fishing expedition to really try to get a sense of what else is going on in the client's life. That's often not appropriate, so and it becomes a barrier to communication. Gauging the effectiveness of the response. Um, you want to look at how your client is responding to you, and so if you look at the bottom half of the screen, and if clients are responding in this ways, then there may be some different techniques that you might want to use in terms of how you approach the issue or how you solicit the information that you're getting from your client. Again, so keeping in mind about those barriers that we just talked about as well. The challenge of learning those new skills. Here, and part of why we do what we do in this particular class around some of the videotaping is really to give you a sense of how you communicate, what it looks like when you come across, because we're not always aware of what we look and sound like until we actually see it played back. So again, the supervisor's role really is to, or in this case, the instructor's role is to really give you that feedback that you can utilize to make sure that you're doing growth in terms of that. So that's why the videotaping is useful. Maybe nerve-wracking, but it's also a good tool to help you see how you were actually responding, so that it's also a source of learning those new skills. So here are some tools that you can utilize as you're preparing for your own interviews in terms of practicing and really looking at how often you're doing these things in a certain time frame. So really looking at and being fairly deliberate about how you are coming across and how it is you're actually responding. And so these tools, again, can be very useful for you in terms of really giving yourself a gauge in terms of those things. So as we move on to Chapter 8, we're going to spend a little time talking about assessment. We're going to be looking at some exploring and understanding of problems and strengths. So we've talked just about the barriers and the communication pieces and the counterproductive things that we can do. So now we're going to move past that and really start to look at assessment overall. And so what we're wanting to actually take away from today's conversation is, understanding that assessments involve gathering information and synthesizing it into a working hypothesis. So gathering this information that you get from your clients and putting together what we think might be actually happening for them. Learning that there's a distinction between assessment and diagnosis. The DSM-4, the diagnostic tool that clinical social workers and psychiatrists and psychologists actually use as it relates to making diagnoses. We'll spend a little time talking about some of those major categories, looking at strengths, paying attention to cultural competence in those assessments, looking at the roles and knowledge of framing those that are framed by those assessments, and then things to think about as you're doing the assessments, or where we want to spend some time talking today. So now, the notion of a multidimensionality of assessment basically is saying that we as human beings are very complex creatures. We live in a world that has many layers, and to be effective in terms of our assessment and understanding some of the issues that our clients bring, it's about being able to understand and do an assessment that looks at all of those particular places where we interact in the world. So the multidimensionality of assessment is a really important thing to keep in mind as we're working forward, or as we're working with our clients in terms of really taking a comprehensive, broader look at how we are gauging things. An example would be that, or a statement, I guess, would be that the field of psychology, which is an excellent field that we actually have many common concepts, looks specifically and narrowly at the client and the client behavior, and really focuses on a diagnostic and a treatment plan based on what's being presented in terms of how the client interacts or behaves. It doesn't take into account, as social work does, the broader picture in terms of where folks interact, who's in their living environment, what kinds of things are happening in the other systems around them that may be impacting that particular behavior. So again, priorities being the immediate concerns of your client, the strengths of the resources, and making sure we're listening for legal and safety issues. When we're defining assessment, we're looking at all the items that are here. So again, really wanting to understand from the concept of the client, what's the primary problem, what's really going on. And working in terms of your communications to really start to solicit that information. Looking at legal mandates, are there things that the client is sharing with you that have implications from a legal standpoint that you'll need to actually take into consideration? Or are there things that you're listening for or that are being discussed that really look at safety concerns or health risks? So, an example might be if clients are disclosing to you that there is a child that they may be involved in behavior that's abusive to that child and causes them to be unsafe, then we recognize that, and we'll talk about this later on in the process, that there are some special mandates and decisions and steps that have to take place when we find ourselves in those kind of situations as well. And then really looking at this whole aspect of the product in terms of really getting the data, understanding what it means, and moving forward. So this flow chart really is instrumental in terms of giving you kind of a basis to look at how you assess those strengths and those problems. So looking at, again, the problem through the eyes of the client, making sure that you're screening for health, safety, legal mandates, making sure that you're putting it in the context that is reflective of culture, race, gender, sexual orientation, and in those areas of differences. Looking at the problems and challenges in terms of all the things in this particular block that talks about, or that we need to look at in terms of scoping the significance of some of the issues, and then looking at the resources that the clients have naturally existing in their community, or things that we know that we can help them access in the community. And then finally looking at, where are they in terms of that life transition? So are they a solution or a problem that's presented to you, let's say by a 19-year-old teenage male who's heterosexual, will be different than the very same problem that's given to you by a 50-something homosexual male. They may be the same identical issues, but when you start to look at the life transitions, there are different things that have occurred that need to be taken into consideration. So as you're looking at the overall strengths and problems, that you're able to discern things with that kind of a mindset in terms of really looking at those developmental and life transitions. Assessment and diagnosis. When we're looking at diagnosis, we're looking at a categorization based on specific criteria. So you're looking at behaviors or circumstances that are occurring with a certain amount of frequency that impair clients' ability to function in a typical fashion. And it goes on for a specified period of time. And so when you're looking at those kinds of things, you can usually look at tools that we'll talk about, like the DSM-4, that really talk about or categorize those particular conditions and diagnoses. An assessment is different in that we're looking at gathering the information. We're looking at those symptoms that are related to a diagnosis. We're also really trying to get a good sense of history for that client, current situation, supports, as well as resources to manage the symptoms. So you're looking at a slightly different piece where a diagnosis is really kind of a stamp of what might be happening overall. And the assessment is really looking at some of the other areas around that that we need to take into consideration. So the Diagnostic Statistical Manual, it's a multi-actual system. And as you can see, there are 5 axes. And you can see how the categories are broken down. So under these particular 4 categories, axes 1 through 4, you will have all of these particular groupings of diagnoses, which actual recommendations and symptoms to look for in terms of how folks diagnose. And so this manual is also used for billing purposes. So clinicians have to be able to diagnose a client before they can do a treatment plan, before they can then submit billings to health insurance or other sources of revenue. And so there has to be, just like us going to the doctor. We go to the doctor, they do an assessment, they look at heartbeat, they talk to us about symptoms. They are looking at what our presenting issues actually are. They're looking at the historical piece. And then based on all that information and based on their examination, they give you a diagnosis of whatever the diagnosis is. And then they actually prescribe, in some cases, medication to actually resolve that. So if you think about the diagnostic manual, it's used in a similar way, but it's used by clinicians to really look at some of the disorders that clients struggle with in terms of really being able to have a consistent language in terms of how we do the diagnostics. The cultural competent assessment, and so again, as we've talked about through a good portion of the social work program, the importance of really understanding cultural difference becomes a critical piece here, because if folks don't really have a clear understanding about how some of those cultural differences play themselves out, it can often lead to ineffective service delivery. It could also lead to clients not actually getting the services that they need. And then it can also, in some instances, can have clinicians working outside of their comfort zone or out of their knowledge of skill base. So paying attention to a cultural competency is huge. Recognizing some of these things that are listed here in blue are going to be very valuable approaches or things to consider when you're looking at working across culture. And if you're working in a culture that's different than your own, then it might be to your advantage to spend some time really gathering some information about clients or talking to other practitioners who may be same culture as the clients you're working with, so you can have a basic understanding of some of the things that you may experience, or at least have some idea about things to look for. Emphasizing the strength in the assessments. Oftentimes clients come to us and they have a myriad of problems and circumstances that seem to have no beginning and no ending. But often buried inside of that are actual strengths. So there are things that within the context of the problematic things that are happening in their lives that they're able to do well. They may be in dire straits, but they have a loving and supportive family. People will work to provide income for their families. Typically, folks are able to get along and help resolve problems within the context of the family. All those are strengths that clients oftentimes don't pay attention to when they're in the middle of stressful times or seeking out help. So it's about really helping unpack that and helping the clients actually recognize that there is some strength and they are able to do some things, and they are doing some things that they just may not have been aware of. Again, when we think about these strengths, it's typical for clients that are in distress who are coming to see us to actually overlook or downplay those. So again, it's your responsibility as a clinician to actually surface that wherever you actually can in terms of bringing attention to those overlooked strengths that our clients actually endure. So when you're looking at frameworks and when you're looking at assessment, it's looking at it from these particular four viewpoints. And so really wanting to understand from the individual and the person about the factors that are happening in their lives. You also want to look at what strengths that they bring to the table. What are the resources? What are the assets that are there? What are your environmental factors? What's available to you in your community? Are you connected to a church? Or do you have a large extended family? Or are you isolated and new to the area and you have no one? All of these are things that you need to be able to assess in terms of the work that you do with your clients. And then finally, to look at the deficits, the obstacles, or the challenges. So even with all of these particular things that we just talked about in terms of the individual, the strengths, and some of the environmental factors, what are the things that keep getting in the way? What are the things that continue to be problematic? And really being able to do your assessment taking into account all of these particular areas. Brief solution-focused therapy is a technique that really looks at doing these things. It's just as it's stated, it's brief and it's solution focused. It's really looked at as a treatment modality that comes in with a finite amount of time that we start to readily identify issues and then put situations or resources and circumstances into place to actually move the client quickly through that process. We also know about these different cognitive theories. Behavioral theories as well in terms of and so when you're thinking about cognitive, think about mental, think about the mind, think about the thought process. So it's really looking at doing assessments based on how people are seeing the world, what are they believing, what are their thoughts, whether they're rational, irrational, things of that particular nature. The behavioral theories, the actions and emotions that are created and maintained, extinguished through principles of learning. So again, paying attention to those assessments that focus on the surrounding troubling behaviors are where we spend some time here when we're looking at this particular assessment modality, as well as looking at consequences and gains that folks might have for being involved in ongoing types of behaviors. These are your sources of information. So in the scope of a social work interaction or working with a client, it might be possible to look at or actually utilize all of these sources of information as a way to come to an accurate assessment. But it just depends on the nature of the work that you are engaged to do with the family and who all is involved. When we think about questions and answers in terms of problem assessment, you're looking at all of these things. When we're thinking about questions to answer, these are things that we want to pay attention to as well. When we are assessing children and older adults, we need to also keep in mind this whole notion of maltreatment. And maltreatment is just as it's defined. It's poor treatment for this particular population. Maltreatment can manifest itself in a few different ways. In both children and adult, it could be forms of abuse, where people are being sexually or physically abused. Same for older adults, as well as being sexually exploited or financially exploited. So these are things that we want to pay attention to as we have clients who may be children or older adults, in terms of paying attention to that, because it requires a response from us as social workers. And then these are some of the data sources and interviewing techniques that are used to actually gather some of that information. So with that, it brings to a close um, the video lecture section for our two chapters in question. So as always, we would urge you and encourage you to go back through and read with intent to really understand some of these concepts that have been presented. Come to class prepared. There will more than likely be a lab activity that will allow you to pay attention to some of the things that we just talked about, and will also be very beneficial to you as you get ready to prepare for your videotaped interviews. So with that, read as always, and I will see you in class.